going to tell you about the mediastinum, and it lies between the sternum and the thoracic vertebra from T1 to T12. It is divided into superior and inferior portions by the transverse thoracic plane, which starts at the sternal angle and extends to the intervertebral disc of T4. The superior portion will extend into the anterior thoracic aperture, and the inferior portion is further divided into the anterior, middle, and posterior mediastinums ending at the level of the diaphragm. Now, for some structures, in the superior mediastinum, we have the superior portion of the thymus gland, the brachiocephalic veins, the azygous vein, the superior vena cava, the arch of the aorta, the trachea, the vagus nerve, phrenic nerves, esophagus, thoracic duct, and the recurrent laryngeal nerve. In the anterior mediastinum, we have the inferior portion of the thymus gland, adipose tissue, and some lymph nodes and connective tissue. In the posterior mediastinum, we have the sympathetic trunk and its splanchnic nerves, the hemizygous and azygous veins, the thoracic duct, the thoracic aorta, the esophagus, and the vagus nerves. In the middle mediastinum, we have the main bronchus and the arch of the azygos, which I don't have pictured here, and then the pericardial sac. The pericardial sac on the outside is made of fibrous pericardium, and then on the inside, we have serous pericardium, which will reflect onto itself, covering the heart, and become visceral pericardium. We have two sinuses within the pericardial sac. We have the transverse pericardial sinus, which extends anterior to the superior vena cava and posterior to the aorta and pulmonary trunk. And then we have the oblique pericardial sinus, which is on the posterior side of the heart and is formed when the serous pericardium reflects back onto itself to form the visceral pericardium. So it is a dead end. All right, that's all for now. Bye.